Hi everybody. Sorry I'm late. One of those days. Okay, so sex and your circulation. I'm always talking about circulation, right? Today we're going to talk about your circulation and how it pertains to you. So the first thing I want to know, and I want you to know, is how's your circulation? Okay? What sort of circulation do you have? Do you have a good circulation, a mediocre circulation, a great circulation? All right, so I've developed a very simple way, which we use in the medical field all the time, to see whether your circulation is good. Okay? So, two things I want to start off with. Your tongue. Look at your tongue and see how pale or how pink or how red your tongue is. The more red, the more blood, the more circulation. The more pale, the less blood, right? So you definitely want to get checked by your primary care doctor or any of your doctors that you see and ask them to check your blood and make sure you're not anemic, okay? So that's one of the things that can make you have bad circulation. If you don't have enough red blood cells, enough oxygen to your tissues, you're not going to have good circulation, okay? I'm just touching on a few pointers that I see commonly in the office, right? So you really want to make sure that your tongue is pink and check out for any plaque or any thrush, anything that should not be in your tongue. Always make sure you brush that teeth properly so that you know that it's clean and you can see whether it's pink or not, right? That's easy to do. And if you have any problems, again, check with your doctor because you might have something on the tongue that needs to be removed. So check with your primary care doctor. Apart from the tongue, I also use your fingertips, okay? So take your fingertips and we're going to use your toes, right? The tip of your toes. Look at the fingertip and I want you to press on that fingertip. And when you press on it, I want you to let go and count to 1,000, 2, 1,000. It should get back to pink after blanching within 2 seconds. If it does not get back to pink within 2 seconds, you have a delayed circulation, right? So we're going to do it in the fingers first, which is close to the heart. Then we're going to do it in the toe, any of your toes, which is further away from the heart. So the fingers are going to tell me that, okay, your heart is working well up here, right? It's performing, it's perfusing, it's able to get blood to your organs, especially your fingers, up here, right? But your toes are further away. So it's going to tell me if you can blanch under 2 seconds that you're doing well, but if it takes more time, it means that the circulation is not getting to your toes, which means to me it's not getting to your brain, because those are the extremities, right? So I need you to have good circulation to the toes and to your fingers. So let's check it out and see what you do, right? So we have the fingertip. I'm going to press. I'm going to count to 2 by saying 1,000, 2, 1,000. It should come back to pink within those 2 seconds, all right? So here we go. 1,000, 2, 1,000. So it's back to pink. Do that on your own finger. See whether it comes back to pink within 2 seconds. 1,000, 2, 1 seconds. If it does, circulation in the upper part of your body is good, okay? At least from the heart to the hands, right? If you have a toe issue, I'm going to take off my shoe, and what I want you to do is take the tip of your toe, take your finger, and press on the tip. I want you to do the same thing, count to 2 seconds by saying 1,000, 2, 1,000, and then let go and see whether you're back, right, to the pink. All right, so here we go. 1,000, 2, 1,000. I'm back to the pink, okay? Forget my ashy feet, they're a little bit, they need to be, pedicured. But again, let's do it again. Press the toe, any part of your toe. I want the blanching to go away after 2 seconds. All right, here we go. 1,000, 2, 1,000. It's gone back to pink. Now, my patients know I do it on them, and when I do, and it's delayed, they have a problem with circulation, okay? So your circulation is key in terms of sexual function. So if you're delayed going down to the toes, you're delayed to the organs of sex, which is your pelvis, your groin, your major clitoris, and your penis. They're not getting a good circulation because they are part of that process of the heart pushing blood to the organs. So if it's going all the way down there, it's going to be delayed, especially if it's in the toes delayed. So it's telling me you've got to get the circulation checked. How to get the circulation checked? Go to your doctor, they'll check it. Now, some of the simple things you got to do to make sure that your circulation is good, you can do at home, okay? Which is why I have a setup here for you to do it at home, and you can check and see from the basics if you have any problems, okay? If you have any problems, you can take the information to your doctor and they can look further into it. Okay, now, one of the important things I talk about, you hear me talk about it all the time, is your blood pressure. See? I want it less than 120/80. I do not want to hear, oh, my blood pressure is 130/90. Oh, my blood pressure is 140/82. No, I insist, and I always will insist, on getting it less than 120/80. If it's not less than 120/80, I want you to aim. And you can do that, again, lifestyle modifications, changing your diet, get off the sausages and bacon, y'all. And, you know, eat less fast foods, less fried foods, less fatty foods, exercise, just eat lots of fruits and vegetables. You just want to do things that are good for circulation. Now remember, the blood pressure is what you get when your heart is contracting and relaxing, trying to go through the circulation, because those arteries can be tight if the blood pressure is high, and it won't let that blood pressure, it won't let the blood circulate easily, and that blood pressure will get higher and higher, and then next thing you know, it'll block off circulation to the brain, the heart, the kidneys, and then you have strokes, heart attacks, and renal failure, okay? So that's when that blockage closes, right? So you want to make sure, I don't care how you do it, with medications or with diet, exercise, I don't care. I want that blood pressure open so that blood will flow to the brain, flow to the heart, flow to the kidneys, and you'll have, to the groin, great circulation, right? The most important thing that you want to do is check that blood pressure and make sure it's less than 120/80, okay? If it's not, go to your doctor. I'm going to repeat it over and over again and get it down to 120/80, because the 120/80 is where you can perform sexually the best, and you have no damage going on in your organs from blood pressure issues. But at 120/80, it has been shown to show that you do get damage to the brain, the heart, the kidneys at 120/80. All right, so please aim for less than 120/80. Okay. Now, how do you check blood pressure? I have some blood pressure cuffs, right? Swigs, right? Now, these are what we do in the office manually, right? We take these different blood pressure cuffs and we put them around your arm, okay? Now, it's important for you to know this. You can do this at home with the digital one, but I want you to know that when you go to your doctor's office and they put a swig around your arm, for you to know the proper size, it has to be at least 3/4 covering the upper arm. Okay, so there should be a little bit up there. Okay, 1/3. I'm sorry, I said 3/4. 1/3 available, open without it being covered, and 2/3 covered. Okay, so then they wrap it around, and then they take the stethoscope, and put it on that pulse, the brachial pulse right there. Now, when you see them putting it in the middle, you want them to put it at the side, on the middle aspect, right? So when you put it here, you'll be able to see that it's wrong, that there's no pulse, there's no artery there. It's got to be on the inner side. I'm always correcting my assistants that come and do blood pressure, trying to let them know the pulse or the artery, the brachial artery is right here. You do it over here, you can't hear it very well. So please make sure that they're doing it on the medial aspect, all right? And then they're going to, pump this up and pump it up with the stethoscope, listen to the pulse or the beating, and then get the blood pressure diastolic, systolic first and then diastolic, okay? So it's very important for you to see that they're doing it right. Now, if you're lucky and you have a nurse or someone that's medical that knows how to do it, please, the manual blood pressure is much better than the digital ones, unless you got the ones that are like $1,000, $2,000, all right? But these ones that are just for $50 or $30. This is $50. This is the one I prefer. Then you just get that one and you'll be able to measure your blood pressure. Are they accurate? No, they're not. But hold on a second. You see how that size pretty much is good for me? I want you to see that was just the regular adult cuff. This is the large adult cuff. Okay, see it's a little bit bigger. And then if you go around, you see it's a little bit covering more, right? It's actually covering more than what I want it to cover, more than the 2/3. Okay? So when you're getting that blood pressure around here, no, I want to see a little bit more space here, and then 2/3. So if it's too big, it's too big. Do not use one that is too big. Remember to look at it. This is a large adult, unless you've got large arms. Guys that have a lot of muscles, a lot of length there, you can use that. But if you're not muscular, you want to use one that, again, fits your arm, your upper arm. So remember, 2/3 should be covered, 1/3 should not be covered. Because if it's too small, like less than half of your arm, you're going to get a higher blood pressure. And if it's too big, you're going to get a lower blood pressure. So it's not going to be as accurate as when you get that measurement with the right size cuff. So remember, 2/3 should be covered, 1/3 should not be covered, okay? So that was the large adult. And then for my bigger arms, you'll see I have one of the biggest cuffs called a thigh cuff. And you can see this is for the even bigger arms. You can see it's covering more, right? So that is for someone that has much bigger arms, and then they can use the much bigger, we call that the thigh cuff, and then they can get a better accurate reading for the blood pressure, okay? All right, so this is the digital blood pressure monitor that most of you have, those that have blood pressure issues. And I'm going to encourage you, if you don't have one, pick one up. It is crucial because you never know, yourself, loved one might need one. And it's $50, CVS, $50. Now, I like this one because it actually gives me more reliable numbers than the rest. I bought the expensive ones, I bought the cheaper ones, and this is the one that works for me. I'm not getting paid to say that CVS works. I'm just saying that I like this one because my patients get more accurate readings. Find one if you get accurate readings, stick to it. Take your blood pressure cuff to the doctor's office. When they do the manual, you do your digital, and you see if it matches. If it's not close by a few points, I'll say maybe less than 5 points difference, you can use this. If it's more than a 5-point difference, do not use it. Up or down, do not use it. Get a new one, take it back, get your money back, and exchange it for another one. And again, it's luck of the draw. If you're lucky, you get a good one. If you're not lucky, you're not going to get a good one. But please take it back. Do not keep it. I remember I bought one, and it gave me 10 different blood pressure readings in less than 5 minutes. And I said, all right, take it back, and got this one, which was much more accurate. So just get something that's not too expensive, but accurate is the most important thing. Take it to your doctor's office and double check, okay? Blood pressure, blood pressure, blood pressure. That's the number one vital sign that I want you to make sure that you have at your fingertips. That means you have it in the house, wherever you are, so that you can check it. Men, you are walking around with high blood pressure. You are not being fair to us. We want you alive. We don't want you dead. I'm saying that word dead. My dad died at 50. All my uncles died in their 50s from high blood pressure. Okay? He's not here. And when I see him again, I'm going to ask him why. But right now, I know I'm here to at least help people that are listening to me, some guys that will understand that it does matter that we want you here. And if you measure your blood pressure and it's high, it's such a simple fix. So I'm going to ask my dad, why didn't you fix your blood pressure? So I'm asking you, why don't you fix your blood pressure? There is no reason. It's one of the simplest things to do. And I don't care whether it's prescription medications, herbs, weight loss surgery. I don't care what it is. Get that blood pressure down because you will live. And it's such a reversible, easy way to keep longevity and keep you alive. Because if you don't, that blood pressure more than 120/80 is going to damage your heart. Your heart's going to get weak, and by the time you're 30, 40, 50, it's too late. It's irreversible. So the simplest reversible thing you can do is keep your blood pressure down. I have kids 13, 14, 15 walking with high blood pressure. It is not acceptable. Measure the kids' blood pressure. I have a baby pediatric cuff for the kids. Of course, they are measured when they're born, and their pediatrician will measure the blood pressure. But listen, you can get a pediatric one, make sure the blood pressure is lower. It's actually much lower than this, and the kids are much lower than this. But what I'm trying to say is it should never be more than 120/80. If I see a teenager 120/80, I'm not happy. It should be less than 120/80 in teenagers, right? So make sure that blood pressure is checked. I'm going to keep on singing blood pressure, blood pressure, blood pressure, because it is a simple, reversible condition. And if your doctor or your friends or your family tell you that, oh, she's talking smack, that you cannot get your blood pressure down to 120 or 80. Come to me. Come and talk to me. Call me, because I can get your blood pressure down, guaranteed. I will find the reason why you can't get it down, and I'll get it down. Okay, I'm bragging. I can't say 100%, but I will try my best to get it down, okay? 120 over 80 and less. So I'm saying 117 over 75 is perfect. Picture perfect, okay? All right. The other device I like to use, and I want you to have this at home, especially when COVID hit, right, is the pulse ox, right? This tells you about your oxygen level. I am telling you, this saved lives in my office. When COVID came around, I would ask them, what is your oxygen level? And when I see the oxygen level not good, I would always make sure that they were checked for COVID and make sure I boost their immune system, right? Okay, so this is a pulse ox, pulse oximetry. Just say pulse ox or oxygen machine, whatever you want to call it. You can buy this at any of the pharmacies, 20 bucks, online 20 bucks, maybe in the stores 40 bucks, online cheap 20 bucks. It gives you not only your oxygen level but your pulse. So you put it on, okay? You put your finger in and leave it for a few minutes. It'll tell you your oxygen level at the top, which is, it says O2, and then your heart rate at the bottom, okay? When you get that number, the oxygen level should be 95 and above. 95, 96, I'm actually not happy that it's 95, but when it first calibrates, it might not be that good. But I want it to be 95, 96, 97, 98, 100, okay? Now, you see my pulse is high for some reason, so I've got to make sure that that comes down. Might be something that I ate or drank. So you've got to make sure that your pulse is not too high. Now we go 97 with the oxygen level, which is great. I'm coming down with my pulse now. I'm going to 97, 98, okay? And that's what I want you to see when you're doing your pulse ox level. So 97 tells me about the oxygen going throughout your body, okay? If you're 95, when COVID was around, I'll panic. 94, 93, 92, I'm panicking more. So get a pulse ox. Make sure you can check your oxygen level. And I'm saying when you're not well, when you're sick, check it, because it'll tell you to get checked by a primary care doctor if you're less than 95, okay? I can tell you I see it all the time, and I get chest x-rays, and I do studies to find out what could be going on in the lungs. Because your lungs, you breathe oxygen in through your nose, it goes to the lungs, from the lungs to your heart, and your heart now takes it to your body. So if your lungs are not working and it's not getting to the heart, sleep apnea number 2 issue, right? For lungs, there are many reasons, but I check sleep apnea all the time. Make sure you're not snoring. If you're snoring, you might not be getting oxygen to your lungs and to your heart, which means your circulation is going to be poor, which means your circulation, when I check your toes and your fingers, is going to be poor. So there's so many reasons why you might have bad circulation. Sleep apnea is very common. If you're snoring, get the sleep study test done, which can be done at home, right? They can now do it at home. You just ask your doctor. They'll send the kit to you at home. You hook it up, go to sleep, and then they will check your oxygen level and check if you're sleeping, pausing sleeping when you're sleeping, right? When you pause and you stop breathing, okay? That will make you have the diagnosis of obstructive sleep apnea, which is not difficult. It's an easy fix. Again, you put on that CPAP machine at night for at least 4 hours. So you all that have the machine, use the machine, because you're going to get oxygen throughout your body to the groin, which wants oxygen, and it needs blood to be able to perform sexually. So remember, I told you, if you're not doing well, it's telling me if you're not doing well in the groin, it's telling me you're not doing well all over. You're having issues that your whole body's suffering with. And these are clues we can follow and fix, reversible, like that, okay? So oxygen level gives me a lot of clues, and your heart rate will give me a lot of clues. If your heart rate is too low, there's something going on. If it's too high, like in my case, it's a little bit too high. I know why, but you don't want it to be too high. Normal reading for pulse is between 60 and 80. 100 is the limit. I don't want it more than 100, okay? Otherwise, the heart's working too hard, all right? So that's the oxygen level. Temperature. If you check your temperature, 98.7 should not be more than that. It really should be something that you are using that will give you a good guide as to whether you're having a fever or not. If you're having a fever, then you're going to have problems with your circulation, right? So you're either going to be trying to get rid of an infection, but I won't complain about the fever because sometimes it's a good thing. But if you have a fever and you don't know why, please check with your doctor, okay? Last but not least is blood sugar, okay? So anyone can have a blood sugar machine. All you do is go to Kroger, Walmart, one of your local pharmacies, buy one of the cheapest kits for blood sugar. I want you all to get one, especially if you have diabetes in the family, because diabetes affects your circulation. Sugar affects your circulation. There are pre-diabetics, there's PCOS, which is polycystic ovary disease, there's insulin resistance, there's glucose intolerance, there are so many different sugar issues. And trust me, a lot of us are pre-diabetic, right? That means we eat too much sugar over the years, and then it comes in and slowly causes weakening of the circulation, especially to the groin. My diabetics have the toughest time performing sexually because it not only stops circulation and reduces circulation, it damages that sensation, it damages the nerves. So sugar should be checked all the time, especially if you're diabetic. And I want your sugar. All right, you ready for this? I want your fasting sugar, which means at night, no food from 12 o'clock till morning. You wake up in the morning around 8 o'clock, you check your sugar. I want it 70. I want a blood sugar of 70, okay? So 70 is where you get the best circulation, right? That means sugar is not damaging the circulation. And what you'll see is that you put this on, right, when you stick your finger. So you take some alcohol, right? I'm really not going to do it, but I'm going to show you. Just clean the area right at the side. You can do this at home. Check your own sugar. You clean the area by the side. You take one of these disposable pinprick devices. You push down like that. You'll get a little pinprick. You take the strip that comes with the kit. You put it inside here. It has a little opening here. And then with that finger that you have some blood, you just push this in. It'll go on. And then you just let it suck up the little drop of blood, and it'll start to read it. And when you read it, you'll get your sugar number. Very easy. Pick it up at any of the pharmacies. This is not something you have to have a degree in. You can do it all the time, again, on yourself, your kids, your loved ones. Just check and make sure the blood sugar in the morning, fasting, without any food, is, okay, under 100, okay? Above 100, go see your doctor. It should not be above 100 in the morning. I'm saying it again. If your blood sugar is above 100, it's too high. It's going to hurt your sugar. It's going to hurt your circulation. And so that sugar needs to be reduced. Why? Diet, right? Because the diet is changing our sugar levels over the years. We're having more diabetes, more weight gain, more obesity than we should have. So just try your best and get that sugar down to under 100 if you can, all right? Diabetics have a tough time doing that, but you should be seeing your primary care doctor or an endocrinologist, making sure your sugar is good. I want it as close to 100, even you as a diabetic. If you're pre-diabetic, I want you as close to under 100 as possible. If you hit 100, I'm going to be okay, but I want you under 100. Remember, there's type 1 diabetes, type 2 diabetes. I don't care. I want your sugar down to as close to 100 as possible. Now, if it's in the family, that's where you should get one of these and be checking your blood sugar, okay? Oh, you can use gloves if you want to, but if you're doing your own blood sugar, you don't have to use gloves for yourself. The Band-Aid you can also use after the blood is stopped. You can put it on if you need to put it on, but otherwise you don't have to, okay? I know I talked a lot today, but I really wanted to emphasize blood pressure less than 120/80. Oxygen level should be at least 95 and above. Heart rate should be between 60 to 100, not more than 100. And your oxygen level, your sugar level, I want it to be under 100. Okay, guys? All right, all to improve sexual function, all to improve circulation to the groin, because if you don't have good numbers, you're going to have poor circulation. And remember, the test is to take your finger and press. Blanch. If it turns back pink within 2 seconds, you're good. Same thing with your toes. Okay? All right, guys. Have a great evening. See you next time. Bye.